So, Assalamu alaikum class. This is the part 2 of the lecture. Uh, so we will continue forward with the lecture. So we were talking about the biomechanical forces that were acting on your hip joint. I've just told you that the biomechanical forces, the body weight is usually constant, and the forces that act on the other component, it is determined by this abductor force. So these forces collectively control or form the joint reaction forces. Now, what is important here to know about the joint reaction forces is that these are the forces that have to be borne by this joint and the bone. This entire force will be borne by the joint and the shaft of the femur. So they depend upon the body weight and the abductor force. So greater the body weight, greater this abductor torque, greater will be the joint reaction forces. So greater the joint reaction forces, greater will be the impact on the joint. Now, class, we will now come. This is the normal mechanics. Now we will come back to our hip replacement joint. Imagine if the hip is placed here. What will happen in this scenario? You can imagine. Now, implants are designed to allow a pain-free and smooth movement, but they are not normal joints. They cannot. You cannot expect them to display the role that has been placed by the normal joint. So what will happen? Stress will be placed on the implant, determined by the joint reaction forces, which are then determined by the body weight and the abductor forces. Hence, you can say that uh, if you reduce the body weight, it will reduce the joint reaction forces. This abductor angle here is determined by the attachment of the abductor to the femur. It can change in condition known as the coxa vara and coxa valga, if you remember these conditions. But we will discuss them some other time if needed. So this is the relationship between joint reaction forces, the body weight, and the forces acting by the abductors. So class, if implant is placed in here, a person must either reduce the body weight to reduce the joint reaction forces or change the torque that is created by the abductors. This can be done, for example, by altering their movement patterns. For example, walking slowly. You can imagine when you are walking or moving fast, the joint reaction forces will be greater, so will be the abducting forces and the relative body weight. For example, in one stance phase, for example, standing on one limb, the body weight acting on one limb will be greater. So greater will be the abductor forces, greater will be the joint reaction forces. So altering these forces in this way can reduce the stress on the implant. Again, you can review the video to understand it again for better understanding. So after understanding this fact, we will now talk about a little bit about the gait biomechanics. So, many researchers have found that patients with total hip replacements often have various functional biomechanical deficits, including problem with balance and slower walking speeds. Now, this balance and slower walking speed is specifically because of the reason I have described you to counteract these forces about the joint reaction, the body weight, and the abductor forces. They alter their balance and walking speed to reduce that stress problem with it. Although it is problematic for them, uh, adequate stress has to be placed on the implant to allow for proper movement nonetheless. So, total hip replacement patient may also have reduced ground reaction forces or pattern of muscle activity, joint forces, or motion compared to the unoperated hip or the normal subjects, which is obvious. In fact, the patterns of biomechanical deficits seen after surgery are very similar to those seen in patients with osteoarthritis. So this is an interesting finding. Now, this suggests both that some gait abnormalities seen after surgery arise because of the disease that lead to hip replacement rather than the THR itself. And that THR does not fully cure abnormal hip biomechanics, even when it relieves pain and disability. So it shows that class K that even with total hip replacement, the exact mechanics before the surgery may not be recovered. Now, in most cases, the functional problems that are detected to gait analysis are not noticeable by the patient. However, your understanding of biomechanics can see or notice the difference between those specific movements. So, in brief, what you should know, class, is that it is desirable to avoid excessive forces on the implant, which will be determined by the body weight and the abductive forces. So, it has been seen that external moments during gait are correlated with the implant forces, and controlling these forces will ultimately determine how this success of the implant will successful function after implant will go. Another thing you should know that walking with a decreased hip range of motion, normal than the actual one, the normal one, may minimize out the out of plane force components and the torque on the implant stems. Torsional loads may especially be dangerous to the stability of the implant fixation, as decreased sagittal plane motion during walking are often seen in patients with these total hip replacements. So, nonetheless, you class should know that despite the potential benefits of this abnormal gait that reduce walking speed or reducing the range of motion, these patterns, they are not without their risk and disadvantage. So they have a risk and disadvantage itself. It has been seen, it was seen in studies that subjects with one total hip replacement are up to 400 times more likely to get the contralateral knee or hip replaced than subjects who do not have a THR or total hip replacement. So, what does this mean? That let me go back to the example to show you. Let's say this is right, this is left. What I'm trying to say you here, imagine that this left hip has been replaced. Imagine, just imagine. Due to altered mechanics, the or not proper way of walking, or not producing adequate stress here, individual will bear most of the weight on the right side rather than the one which has been replaced, leading to greater stress over here, leading to damage of even the normal side, the comparatively normal side. So after left side replacement, it has been seen with time even right side can be for altered mechanics will be altered and lead to replacement. The cause of this may be because people with hip replacement put a disproportionate amount of load on the limb contralateral to the operated hip. This is the reason. Now, what I'm going to talk to you next is just for a brief understanding for you. Now, the bone geometry of the limb on the side of the operated hip may also play a role. For example, the hip offset. What is this offset? You can write it down. The perpendicular distance between head of femur and the femoral shaft. So kindly class remember that perpendicular distance between the head of femur and the femoral shaft. Now this is called the hip offset. This can be changed with the THR surgery. Now changing this offset can alter the alignment of the entire leg. The angle between, for example, the hip, knee and ankle. Alignment is also an important factor that contributes to the development of knee osteoarthritis. So just altering the alignment can lead to many problems. Now, now that as the two limbs are physically and biomechanically linked, changing the mechanics of one leg will necessarily affect the other leg. So, this is the important role of the gait biomechanics that we have studied. Next, we will talk about reconstructed joint geometry. What it means here, class, that you have to understand is that the geometry between the pelvis, the proximal femur, and the rest of the leg can all be affected by total hip arthroplasty. Changing this relationship can have a profound effect on the line of force transmission between the joint and the movement generating capacity of muscles that cross the hip. So, joint geometry considerations make up a key component of the preoperative surgical planning. It has been seen that a surgeon can define or select the size of the femoral head, length of the neck of the implant, and the angle between the neck and the shaft. Now, again, the offset, I have told you again, it is the perpendicular distance between the head and the shaft. Apart from that, the abductor muscle momentum and the location of the hip center relative to the pelvis can be indirectly affected because of this. Uh, now, the acceptable cup component that has uh, I have shown you can be placed in a position of a more or less tilted or anti-version position as well. These changes can affect the amount of forces or the location of the force transmission. So what is meant by this here? Imagine this area has been replaced. Though, so altering the hip cup, altering this joint axis will change the moment arm or change the effect of the forces. Changing this angle of the neck, for example, if they make it greater or make it less, all of these can alter the mechanics that I have just described you here. So these are the certain, you can say, uh, technique or twist a surgeon can apply to alter the geometry of the mechanics of the uh, hip. Now, alterations in the hip center of rotation location have a large effect on the movement generating capacity of the muscles and the resultant hip forces. Plus, this is the center of rotation. Surgeons, when they are going to implant, can even alter the direction of this center through their surgical methods. Let's say it is here, it can even go here by altering this mechanics of the implant. This will completely alter the moment of arm being generated. For example, after the surgery, the center was replaced from here to here by surgical means. Notice it will alter the moment of arm of the abductors and the moment of arm of the body weight. So they can do that. Surgically, it has been seen that it has been predicted or seen that the joint forces are minimized when the joint center is moved medially, perially, or anteriorly. So this is just a surgical understanding, or this is the understanding of the mechanics. So you have to just remember that. Now, this position maximizes the moment generating capacity of the abductor and brings the hip center closer to the line of action of the uh, foot reaction forces, thus decreasing the external moment that is needed to balance by the muscle forces. So, moving onwards, uh, you should also know that higher femoral loosening rates have been associated with joint centers placed superiorly and laterally as those opposed to be placed in the anatomical position. So the purpose of telling you this here is you cannot just play with the joint center as wherever you want. It has to be considered. Placing it superiorly or inferiorly rather than anatomical position can lead to joint losing. So surgeon has to decide how it will be done. Apart from that, like I told you about increasing the neck length or Advancing the greater trochanter can partially compensate for these losses in muscle movement arm generating capacities that has been seen. Other considerations may, however, limit a surgeon's option. For example, the pathological conditions that can lead to total hip replacement, like arthritis, can affect the range of potential location of the hip center. So you cannot alter the hip center more than necessary. It depends upon the cases that has been done. So these are some ways the surgeon can alter the mechanics or the position of the joint. So you just have to remember, class. I will describe the lecture in a nutshell so you can understand the main point. This is the central rotation. Altering its position can alter the mechanics of the moment arm generating by this body weight and the abductor force. So, but central rotation cannot be altered too much as it will determine the normal anatomical alignment of these areas. So it depends upon the surgeon how he will continue. You just have to have a knowledge of this. So class, in this example, I will show you the normal mechanics. This is your normal angle between your neck and the shaft. This uh, is the moment arm, this is the center of rotation, and these are the abduction forces that are being generated, and this is the moment arm here. Okay, class? Now, what will happen in a condition known as oxa vera or a varus alignment? Notice what has happened to the moment arm compared to this in varus form. To remember these two conditions here, it has significantly increased. You can see the distance here based on this example. And what about coxa in a valgus point, as shown by represented by here? Notice what has happened to the moment arm. It has decreased. So, uh, rather than going into much greater detail, you just have to remember these important points that I'm telling you. This is the normal moment arm of abductor and the central rotation. In coxa vera, moment arm will be relatively greater than the normal. In valgus, it will be reduced. So you just have to remember this. It is important for the MCQ point of view. Now, in addition to the magnitude of hip forces, number of loading cycles is a critical determinant of the implant wear and longevity. What do I mean when I say loading cycle? It is the number of times load is produced on the implant. For example, during walking for a year, how many loading cycles it can be, that can vary. All of these will affect the tear on the implant. So, interesting to know is that patients in all age groups, uh, patients in all age groups expect THA to allow them to maintain an active lifestyle. So either whether they're old, whether they're young, they want an active lifestyle to be maintained after that THA replacement that has been done. Number of steps walked per day or year is often considered to be a good marker of activity and an analog of the number of loading cycles for uh, testings. So the number of steps he takes per year is a good understanding of his level of activity. This is the purpose of this topic here. Uh, we will not go into excessive detail about this uh, topic about the level activity, you just have to understand that the magnitude of forces on the hip, the loading cycles, for that determines the activity level and the level of wear and tear that occurs on this uh, repair hip replacement. So we will move onwards. The complications influenced by hip biomechanics. Now, class, it should be obvious to you, and very important fact must be now exposed to you that why you should study the hip forces. Because these study of hip forces completely alter the mechanics or influence the mechanics of the hip replacements. It, adequate knowledge of the forces will determine if the implant will be successful or will not be successful. Now, let me tell you something very important here. That the developments in materials and implant designs have reduced the likelihood of bone loss and wear. However, it is important to understand the underlying concept. Now, periprosthetic bone loss that I have just told you about and the implant wear remains the leading cause of failure and ultimately one of the biggest problem of total hip replacement. Bone loss is an emerging issue in uh, hip uh, problems. An increasingly popular and somewhat more conservative surgical reconstruction for the uh, arthritic hip is this replacement process. So, any wear and tear which you develop in it with time will ultimately determine the fate or the level of activity of that individual. As physiotherapist, you must your role basically is to give proper range of motion exercises or proper gait biomechanics. Tell the patient that after the implant he should walk normally, go on with his daily activity. For example, in cemented type of arthroplasties, periprosthetic bone loss is a very big concern. If he does not place adequate stress on this plant, what will happen? Bone loss may occur, proper implant placement will be disturbed, and the implant may loosen, and it will further complicate the patient condition and problems. Another complication that I have to tell you about, which is important, is stress shielding. Now, this results from a decrease in the stress distribution in the femoral bone as a result of the presence of the implant stem, which has a greater or equivalent mechanical stiffness as compared to the femur. What it means here, class, is that when a person is walking, now the forces are transferred through that bone. Okay. Sometimes what happens is that most of the stress is bared by the implant due to inadequate distribution of forces rather than the bone itself. Like I told you, that bone needs a relatively good amount of stress for proper healing and proper function. If implant takes the entire forces away from it, then proper adequate healing will not occur, and ultimately it can lead to further complications and problems. So, as your physiotherapist, your job is to show or tell him by proper mechanics or proper exercises that will place good load on the implanted or affected side and less on the contralateral side, so that an adequate distribution of forces is been done between both of these areas. uh, So this lecture for this week is completed. Now, what I have to tell you, class, here is to review this lecture. The lecture for the next topic is about knee. This concludes our lecture about the biomechanics of arthroplasty of hip. In the next lecture, we will study about your knee, which is of equal importance as compared to the hip. Now, again, if you have any questions, You are requested to kindly review this lecture after midterm has been completed. After the completion of midterms, you are required to view this lecture. I have tried my level best to make it as interactive as possible for you students, so you can have as little as problems as possible. But you must read this lecture from here. Study this lecture from here. Any question must be written on a pen, on a paper using a pen. If you have any questions that you would like to ask me, we will have an interactive session. It will be preferred to you to read the book, uh, Biomechanics of Arthroplasty from the Northern Frankel, review the lecture, see the important points that are in this lecture, and we can discuss it later on when we will do our interactive session. So this is all for this lecture. Thank you for reading. See you soon.